Lugol's solution. Yeah, the name itself, it sounds kind of historical, doesn't it?
Oh.
Maybe a bit mysterious even. Comes right out of the 19th century. But its journey is actually pretty wild. From, well, a failed attempt to treat tuberculosis back then to playing a role in nuclear safety, believe it or not. And now it's right in the middle of some pretty heated health debates.
Okay, let's unpack this. Today we're doing a deep dive into Lugol's solution. It's this compound that kind of surprisingly shows up everywhere from, precise lab work to these really passionate arguments in health circles.
That's right. Yeah, we've waded through quite a pile of sources for this one. Articles, research papers, the whole lot. We're going to try and peel back the layers on it, look at what it actually is, its, let's say, established uses, and then, tackle the really tricky stuff, the controversy around taking it internally. Right. And our mission today for you listening is to cut through some of that noise you might hear, maybe online or wherever. We want to pull out the key things you need to know, give you a shortcut to being genuinely well-informed about Lugol's. Understand its real uses, the possible upsides, and maybe most critically, the very real risks if it's not used properly. But let's jump in. Okay, starting right at the beginning, the basics. What exactly is Lugol's solution? What's in the bottle?
Okay, so at its core, Lugol's is basically a concentrated iodine solution made with water. What makes it kind of special is that it has both elemental iodine, that's I2, and potassium iodide mixed together. It goes way back, actually, invented in 1829 by a French doctor, Jean Lugol. He was hoping initially to treat tuberculosis with it. Didn't work out for that, unfortunately. But despite that false start, it pretty quickly became a standard thing in medicine and also in, analytical chemistry labs. It's got a long history.
And it's not just one strength, is it? I've seen different percentages mentioned.
Yeah.
When people talk about Lugol's, what are we usually dealing with?
Exactly. Good point. The most common one you hear about, particularly in Europe, say Germany, for instance, is the 5% solution. Now, what that means is in 100 milliliters of water, you've got 5 grams of the elemental iodine and 10 grams of potassium iodide. And that potassium iodide itself adds another roughly 7.6 grams of iodine. But here's the kicker, to make it really practical for you. One single drop, just 0.05 milliliter of that 5% stuff, contains 6.3 milligrams of iodine.
Wow. Okay, 6.3 milligrams in one drop. That immediately flags why this needs careful handling, doesn't it? Especially when we think about daily iodine needs being in micrograms.
Precisely. It's a massive dose in a tiny volume. And yeah, there are weaker versions too, for context. Like a 1% solution gives you about 1.25 milligrams per drop. 2% is 2.5 milligrams. What's also interesting, though, is that these different forms of iodine matter. The body uses them a bit differently. So iodide, that's I minus, that's mainly what your thyroid grabs onto to make hormones. But your skin, brain, ovaries, they use it too. Then there's the elemental iodine, the I2. The thinking is that's used more by tissues like the breast, prostate, the gut. But the body's pretty smart. It can convert iodide into elemental iodine if needed. You also see iodide, like in iodized salt, it's more stable, so they use that. Your body just turns it into iodide anyway. And, natural sources like seaweed, they often have a nice mix of these forms.
Okay, this is where it gets, really interesting for me, seeing just how many hats this one solution has worn. It's got this long, varied history in labs and doctors' offices, way beyond that TB attempt. What were some of the established uses?
Oh, yeah. It was quite the workhorse, really. In labs, it's famous for starch staining. Iodine hits starch, gives this really deep color, super useful. In gynecology, for example, doctors used it for cervical exams. The idea is that abnormal cells tend to have less starch, so the Lugol's helps highlight them. Pathologists used it, too, to look for something called amyloidosis, these protein clumps that can build up in organs, think Alzheimer's in the brain, that kind of thing. And, of course, gram staining in microbiology. It's fundamental for telling different bacteria apart, still used constantly.
Incredible range. So beyond those specific lab tests, was it also something more, common, like for first aid, or maybe used in hospitals for certain procedures? Like I heard something about thyroid surgery.
Absolutely, yes to both. Historically, before surgeons operate on someone with an overactive thyroid, they'd often give them really high doses of iodine for a short period. It triggers something called the Wolff-Chaikoff effect.
Wolff-Chaikoff,
yeah.
Right. So it's like hitting the brakes on the thyroid temporarily, making it easier to operate.
Exactly. That's a good way to put it. When the thyroid gets flooded with iodine, it sort of shuts down temporarily, reduces iodine uptake, cuts back hormone production, even lessens blood flow to the gland itself. Made the surgery much safer and easier back then. But As you guessed, we don't really do that much anymore. Modern drugs, thyroid inhibitors like thiamazole, they work well and have fewer side effects generally. And yes, wound care too. It was definitely used for disinfecting wounds because it's strong antiseptic, kills germs. But again, it's largely been replaced, mostly by povidone iodine ointments now. They do the job, but Lugol's itself can be pretty harsh, irritating on the skin. Povidone iodine is much gentler.
Okay, so we've traced it from, that early medical idea through diagnostics, historical treatments, but now we get to the really, let's say, controversial part, the modern discussions about taking it internally. This is where things get complicated, right?
This is absolutely where we need to be crystal clear and issue a really strong warning. Lugol's solution is not, I repeat, not a general dietary supplement for you to just take internally. Like you pointed out, that one drop of 5%, 6.3 milligrams of iodine, that's more than 30 times what most adults need in a whole day. In places like Germany, it's flat out not approved for internal use. It doesn't meet food safety standards. It's meant for external use, period.
But hang on, I think I've read about exceptions. Like in the U.S., isn't it sometimes used as a medication under prescription for really serious situations?
That's true. There are very specific emergency medical uses, like something called a thyroid storm, which is a life-threatening surge of thyroid hormones. It's a rare complication of hyperthyroidism. In that critical situation, doctors might use high-dose iodine, leveraging that Wolff-Chaikoff effect to quickly shut down hormone production. It's an emergency brake, essentially. And yes, it's also part of some specialized high-dose iodine therapy protocols, but again, we're talking under strict medical supervision for diagnosed conditions, not something for general health. Now, let's talk risks, because they are significant if people misuse this stuff. Ingesting high doses, well, the elemental iodine can really irritate your mouth, your throat, your esophagus, and in really rare cases with extremely high doses like gram amounts, way beyond accidental ingestion, you could see severe acute reactions, dangerous airway swelling, circulatory problems, breathing issues, fever, vomiting. Very rare, but possible at toxic levels. What's more relevant, maybe, is the risk from chronic overdoses, even at lower, but still excessive doses. This can actually damage your thyroid permanently, leading to either hyperthyroidism or hypothyroidism that doesn't go away. And there's a specific danger for people with Hashimoto's disease, the autoimmune thyroid condition.
Right, I've heard iodine can be tricky with Hashimoto's. Why is that?
Well, when the thyroid makes hormones, it naturally produces a bit of hydrogen peroxide. It's part of the process. Normally, your thyroid has antioxidant systems to clean that up, but in Hashimoto's, those systems are often weakened and the thyroid is already inflamed. So flooding it with extra iodine forces more hormone production, generates more oxidative stress from that hydrogen peroxide, and that can actually worsen the inflammation and speed up the destruction of the thyroid tissue. It fuels the fire, basically.
That makes sense. So generally very risky internally, except for that one very specific government-approved scenario, the jaw blockade for radiation protection. That seems like the big official exception.
Exactly. That's the key exception. It's purely an emergency preparedness measure. If there's a nuclear accident or attack releasing radioactive iodine, governments, Poland is often cited, they use Lugols for. This might distribute high-dose iodine tablets. The goal is simple: flood the thyroid with stable, non-radioactive iodine very quickly. This saturates the gland so it physically can't absorb the dangerous radioactive iodine that might be in the air or food. It blocks uptake. This dramatically lowers the risk of developing thyroid cancer later on from radiation exposure, but it's strictly for that acute, high-risk scenario.
Okay, got it. Emergency use only for that. But that brings us to the people who advocate for high doses outside of emergencies. You hear names like Dr. Abraham, Dr. Brownstein, Dr. Fleches. What's their argument? Why do they think we need so much more iodine?
Right. These are the main proponents of what's called high-dose iodine therapy. Their fundamental belief, their core argument, is that the official recommended daily allowances, the RDAs for iodine, are drastically too low. They argue these low levels only prevent goiters, the visible thyroid swelling, but they aren't enough for optimal health in all the body's tissues that use iodine, not just the thyroid. They link this perceived widespread deficiency to a whole range of problems, from thyroid issues, yes, but also things like fibrocystic breast disease, maybe even helping detoxify things like bromide or fluoride from the body. Dr. Brownstein, for example, really pushes the idea that adequate iodine is crucial for overall cellular function. But, and this is a really crucial but, Daltha, they themselves usually add a big caveat. They generally do not say everyone should just start taking massive doses. They emphasize that it requires careful individual assessment, testing iodine levels, and close monitoring by a doctor who knows what they're doing to figure out if someone needs it and what the right dose is. And It's fair to say these views are definitely not mainstream conventional medicine. Far from it.
So just how different are the numbers? If official recommendations are, what, 150, 200 micrograms a day, what are these advocates talking about?
The gap is, well, it's huge. Official guidelines, like from the German Nutrition Society, DGE, or the WHO, they hover around 150 to maybe 260 micrograms a day, depending on age and pregnancy status. The high-dose advocates argue that's just goiter prevention level, right? Remembering that iodized salt was basically brought in just to stop widespread goiters, even the European Food Safety Authority, EFSA, sets a safe upper limit for long-term intake at 600 micrograms daily. Still micrograms. But the therapists promoting high-dose iodine, they estimate daily needs could be anywhere from 12 to 50 milligrams. That's 12,000 to 50,000 micrograms.
Wait, sorry, do you say milligrams? 12 to 50?
Milligrams, yeah.
That's staggering. It's 60 to 250 times higher than the official recommendations. How on earth do they decide someone needs that much? There must be some kind of test, right?
There is a test they use, but it's also, frankly, quite controversial. It's often called the iodine loading test or iodine saturation test, developed initially by Dr. Guy Abraham. The basic idea is you take a large dose of iodine, typically 50 milligrams, often using specific tablets like Iodoral, which have forms similar to Lugol's. Then you collect all your urine for the next 24 hours, and it's sent off to measure how much of that iodine dose you excreted. The theory behind it goes like this. They estimate the body's maximum iodine storage capacity is around 50 milligrams. So if your body's full, most of that 50 milligram dose you cook should just spill out into the urine. If you excrete, say, less than half of it, they interpret that as meaning your body was thirsty for iodine, holding on to it, suggesting a significant deficiency.
It's like pouring water into a sponge, sort of. If the sponge is dry, it soaks it up. If it's saturated, the water just runs off.
That's a decent analogy, yeah. But again, conventional medicine really doesn't accept this test as valid or reliable for diagnosing deficiency or guiding therapy.
Why not? What are the main criticisms? Is it the test itself or the interpretation?
It's several things, really. There's no real standardization for that initial dose amount or how it's administered consistently across practitioners. But the biggest issue is the interpretation. How much excretion equals what level of deficiency? It's not based on broad, validated clinical data that links specific excretion levels to actual health outcomes or universally agreed upon deficiency states. The reference ranges they use are largely based on the theories of the proponents themselves, not widespread scientific consensus. Plus, kidney function and other factors can influence excretion rates. So, the strong advice remains, if you have symptoms, especially thyroid symptoms, see a doctor. Get proper, validated tests for thyroid function and maybe iodine levels if indicated. Don't rely on controversial, unvalidated tests. And if you suspect dietary issues, focus on food sources first.
Okay, really good to clarify that. Let's move into some of the conditions where high-dose iodine is often discussed. Breast cancer is a big one. What's the actual evidence connecting iodine, especially high doses, and breast cancer?
Right, this often comes up. A common observation used by advocates is the situation in Japan.
Yeah.
People there traditionally consume much more iodine, definitely in the milligram range daily, mainly from seaweed. And it's true, Japan historically has had significantly lower rates of breast cancer compared to, say, the US or Europe.
But there's always a but with population studies, isn't there?
Yeah.
Correlation isn't causation. The whole lifestyle is different.
Exactly, you nail it. It's a huge leap to attribute that difference solely to iodine. Diet, genetics, environment, screening practices, so many factors are different. And crucially, studies show that when Japanese women immigrate to the U.S., their breast cancer risk gradually increases over generations to match American levels. That strongly points towards lifestyle and environment, not just iodine intake or genetics alone. And for balance, it's also worth noting that even within Japan, those areas with very high iodine intake from seaweed also tend to have higher rates of hypothyroidism. Some studies show rates over 12% in coastal areas versus maybe 2-3% inland. There's also data suggesting a link between high chronic iodine intake and increased thyroid cancer risk in some populations. It's not all positive.
Okay, so the Japan comparison is complex. Is there any more direct research linking iodine to breast tissue or cancer cells? Lab studies, maybe?
Yes, there is some more direct and potentially promising research, though still mostly preliminary. In lab settings, using cell cultures, researchers have found that adding iodine can actually stop breast cancer cells from dividing, interestingly, without harming healthy breast cells in the same dish. There are also animal studies. One in rats found that giving them iodine at a dose equivalent to about 500 micrograms a day for humans, so not super high, reduced the incidence of chemically induced breast tumors by about 70%. And perhaps most interestingly, there was a human pilot study. It looked at women undergoing conventional breast cancer treatment. They gave one group 5 milligrams of elemental iodine daily, alongside their regular therapy, both before and after surgery. The results were quite striking. The iodine group had fewer chemotherapy side effects, a better response to therapy overall, and a significantly better 5-year disease-free survival rate, 82% compared to just 46% in the control group that only got standard treatment.
5 milligrams. Okay, that's higher than the RDA, but still way, way lower than the 50 or even 200, 300 milligrams, sometimes mentioned by advocates like Dr. Brownstein, right?
Exactly. That's a critical distinction. This pilot study used 5 milligrams. The extremely high doses, like 50 milligrams, 100 milligrams, or even more, that some practitioners advocate for breast health or cancer are largely untested in rigorous clinical trials. We just don't have the data on their safety or effectiveness at those levels.
What about the other common thyroid issue, hypothyroidism or an underactive thyroid? Does high-dose therapy make sense there, given iodine's role?
Well, iodine deficiency is definitely a major cause of hypothyroidism worldwide. And if that's the root cause, then correcting the deficiency, often with doses closer to the RDA or slightly above in the microgram range, can absolutely restore normal thyroid function. The frustrating thing is, as we touched on, doctors don't always test for iodine deficiency specifically. So someone might get diagnosed with hypothyroidism and put on thyroid hormone medication like L-thyroxine for life, when maybe, just maybe, addressing an underlying iodine shortfall could have fixed it. There was a study, for instance, showing that giving patients with hypothyroidism caused by severe iodine deficiency just 200 to 400 micrograms of iodine daily from kelp was enough to normalize their thyroid function within a month or two. But again, the high-dose advocates often use milligram doses for hypothyroidism too, and frankly, there's just no solid research supporting the safety or effectiveness of those massive doses for this condition. The potential risks, especially triggering thyroid autoimmunity or worsening Hashimoto's, seem to outweigh any unproven benefits at those levels. So this brings us back to a really vital point for anyone listening. If you're considering high-dose iodine therapy for any condition, but especially something serious like cancer or thyroid disorders, it is absolutely essential, non-negotiable, really, that it's done under the guidance of a properly qualified and experienced healthcare practitioner. This isn't DIY territory. It involves thorough checkups first, especially your thyroid status and kidney function, making sure you have enough cofactors like selenium and tyrosine, which the thyroid needs to use iodine properly, determining your individual needs, starting low, increasing doses very gradually, and monitoring closely for side effects. And honestly, finding practitioners truly skilled and experienced in doing this safely, particularly somewhere like Germany, can be quite challenging.
Okay, that's a very clear message on the internal use front complex. Risky, needs expert guidance. So let's pivot. Where can Lugol solution be genuinely useful and relatively safe for you, the listener, maybe for more practical everyday things?
Right, that's a great question because for external topical use, the kind you can buy over the counter, Lugol's is actually quite versatile and generally much safer. For topical application, it's usually best to stick with the lower concentrations, like the 1% or 2% solutions. You only have the 5%, you definitely want to dilute it. A common way is mixing it with an oil, like maybe 90 milliliters of coconut oil with 30 milliliters of the Lugol solution. But even diluted, you still need to be a bit careful. It can irritate the skin, especially sensitive skin, and you definitely want to avoid getting it on mucous membranes where it can cause what people call iodine burns.
You mentioned fibrocystic breast disease earlier. Since that's a localized breast issue, is topical Lugol something people try for that? Does the iodine get absorbed through the skin?
Yes, exactly. Fibrocystic mastopathy, those benign lumps and breast pain, often cyclical with hormones, is quite common. Iodine deficiency is thought to be a contributing factor for some women, and improving iodine status can sometimes reverse the changes. Since iodine is absorbed through the skin, topical application directly to the breast area is a plausible approach. And Lugol's is interesting here because it contains that elemental iodine, I2. In breast tissue, elemental iodine gets converted into specific compounds called iodolactones. These iodolactones seem to have a regulating effect, potentially inhibiting excessive cell division, which might also link back to that breast cancer risk reduction idea. Now, there aren't formal clinical trials on topical Lugol's for this specifically, but you hear a lot of positive anecdotal reports from women and practitioners. The suggestion is usually applying it once or twice daily, and apparently noticeable improvements might take around 6 months of consistent use.
Interesting mechanism with the iodolactones. What about the prostate? You mentioned it also needs iodine. Similar logic apply there for topical use?
Pretty much the same logic, yes. The prostate gland is another tissue that concentrates iodine, and deficiency has been linked, at least epidemiologically, to prostate enlargement, BPH, and potentially prostate cancer risk. So again, while lacking formal studies, some practitioners suggest topical iodine therapy for men with enlarged prostates based on anecdotal success. The application method usually recommended is applying the diluted Lugols once or twice a day to the groin area and maybe the inner thighs. Reports suggest some men experience relief from urinary symptoms within a few weeks, but again, it's anecdotal.
Okay, now for that critical question again, Hashimoto's. We know internal iodine is bad news. What about topical? Is that ever okay, or is the absorption still too risky?
This is super important. Given the known risks of internal iodine for Hashimoto's patients potentially worsening the autoimmune attack, we really have to be extremely cautious. While some might suggest topical use as a gentler way to get iodine, the big problem is that skin absorption is notoriously variable and unpredictable. You just can't reliably control the dose your body is getting. So our strong advice for Hashimoto's patients is to avoid topical Lugols as well. The safest way to ensure adequate iodine, if needed, is through careful dietary choices, ideally guided by a healthcare provider who understands the condition. Yes, some studies show topical iodine doesn't usually disrupt thyroid function in healthy people, but those studies weren't done specifically on Hashimoto's patients. And even in healthy people, prolonged use like over 3 months can sometimes start to affect thyroid levels. It's just not worth the risk with Hashimoto's. Diet is the way.
Okay, very clear warning there. What about more general skin stuff? Infections, maybe helping scars heal? Does its antiseptic quality come into play?
Absolutely. Lugol's is a potent antiseptic. It kills bacteria, fungi, and viruses. So yes, you can use it topically for minor skin infections, provided the skin isn't already super inflamed or broken. Using a diluted solution, 1 or 2%, or diluted 5%, applied daily can often clear things up within a week or so. For scars, it's interesting. Iodine seems to promote skin regeneration. Applying it once or twice daily to a healed scar can sometimes lead to visible improvement, maybe making it softer or less noticeable, sometimes even in just a few days. But remember the staining. It stains the skin dark brown very intensely, so you would absolutely not use this on your face or neck or anywhere visible. And again, be mindful of potential skin irritation, especially if your skin is sensitive.
And warts. People try all sorts of things for warts. Does iodine help?
Warts are caused by HPV, the human papillomavirus. Iodine can be effective against viruses locally. Povidone iodine, the gentler version, actually has decent research supporting its use on warts. For Lugol's specifically, there's less formal research, but you do hear positive anecdotal reports of it helping when applied directly and consistently to the wart. Worth a try, perhaps, if other things haven't worked, keeping the staining and irritation in mind.
Good to know the range of potential uses, with all the caveats.
Right.
And thanks for the heads up on staining. You mentioned a trick to get it off skin.
Ah, yes, the stain removal. It looks dramatic, but it's actually easy to get off skin. Just use vitamin C powder, plain ascorbic acid. Mix a little powder with a few drops of water to make a paste. Rub it on the stained skin, and the brown color should disappear pretty quickly. Doesn't work nearly as well on clothes, though. Iodine stains on fabric are really tough, so definitely wear old clothes or protect your clothing when you're applying it.
Great practical tip. Now, sticking with the theme of self-application, there's this DIY skin patch test for iodine deficiency that floats around online. You paint a patch of Lugol's on your arm and see how fast it disappears. How does that work? Supposedly, and crucially, is it reliable at all?
Yes, the skin patch test. The idea is you apply a bit of Lugol's, usually the 1 or 2% solution, to a small patch of skin, maybe on your inner forearm, say 5 by 5 centimeters, rub in until it stains well. The theory, as it's told online, is that if you're deficient, your skin will drink up the iodine quickly and the stain will fade significantly or disappear completely within, say, 12 hours. If you're supposedly sufficient, the stain should last much longer, maybe 24 hours or more.
Okay, but let's be absolutely direct here. This test is widely considered unreliable by medical and scientific communities. Why is it unreliable? It sounds simple enough.
The problems are manifold. First, the small amount applied isn't standardized. How much is well stained, it varies. Second, skin absorption itself varies hugely between people and even on different body parts of the same person. Hydration levels, skin thickness, blood flow all affect it. Third, and maybe most importantly, interpreting the fading is completely subjective. How much fading counts as significant? There's no objective scale, it's just not a scientifically validated method for assessing iodine status. Some sources try to refine it, suggesting repeating it daily and seeing if the fading time changes, which might hint at something, but it's still guesswork. Bottom line, if you suspect deficiency based on symptoms, especially thyroid issues, please see a doctor. Get proper blood tests or urine tests done if they deem it necessary. Relying on the skin patch test is likely misleading. If your diet's the concern, focus on iodine-rich foods.
That's really crucial advice. Prioritize validated medical tests over DIY methods. Okay, wrapping up, are there any other really vital precautions, maybe for specific groups? And where do people typically get Lugols if they're looking for it for, say, topical use?
Yes, absolutely. A final, very important caution regarding pregnancy and breastfeeding. Iodine is critical during these times, no doubt, for the baby's brain and thyroid development, but the dose is key. Because iodine is absorbed through the skin, using highly concentrated preparations like Lugols, even topically, carries a potential risk of exposing the developing fetus or the breastfeeding infant to excessive amounts. This could potentially harm their developing thyroid. So, extreme caution is advised with any concentrated iodine products during pregnancy and breastfeeding. Always discuss iodine intake and supplementation with your doctor or midwife during these times. As for finding it, Lugol solution is generally easy to buy online or from pharmacies, especially compounding pharmacies. The recipes are pretty standard, so products mainly just differ by concentration, the 1, 2, or 5% usually. If you are buying it, it's probably wise to look for one that specifies pharmaceutical quality or similar, just to have better assurance of purity and that the concentration stated on the bottle is accurate.
Okay, so let's try and summarize this deep dive. Lugol's solution. It's definitely a compound with a fascinating long history, and it clearly has some valid established uses, particularly as an external topical remedy for various things we've covered.
Absolutely. But the main takeaway, the message we really want to leave you with is this. While it can be useful externally, venturing into internal high-dose iodine therapy is a completely different story. It carries significant potential risks. It absolutely should only ever be considered under the close supervision and guidance of an experienced healthcare professional who understands the complexities and the risks involved. It really underscores how important it is to be discerning and critical when evaluating health information, especially things that sound like miracle cures online.
Yeah, that really stands out for me too. It's a reminder that some traditional things have clear, proven uses in certain contexts, while others, especially when proposed for internal use at high doses, demand a much, much more careful and skeptical look. So maybe a final thought for you to ponder. We've seen this intense debate around iodine, questioning official recommendations and exploring wider roles in the body. What other common nutrients might be out there, perhaps with roles that are underestimated or fiercely debated? And how can we, as people trying to stay informed, get better at telling solid, reliable health information, apart from the claims that lack real substance? Something to think about.